Hi, good morning. I'm really excited to be here today to be sharing about a participatory visual project with youth living with and affected by HIV in South Africa during COVID-19. And I'm sharing these findings on behalf of a large group, which includes 2 advisory groups in South Africa, as well as a large collaborator team, many of whom are in the room today. And I'd like to begin by acknowledging that we're gathered on the traditional and unceded Indigenous land. The Ganyagai Haga Nation is recognized as the traditional custodian of this land and waters that we're gathered on today. And I'd also like to acknowledge people living with HIV, past, present, and future. And today this presentation is with a group of HIV-affected adolescents living in South Africa. And I'd like to acknowledge this young man who spoke at this very conference 22 years ago. His name was Nkosi Xolani Johnson, and at the time he advocated for the South African government to roll out AZT to people who needed it. Sadly, he died the following year before these medicines were made available. But from this sad story, what I also learned is that adolescents living with HIV can really powerfully advocate for issues that affect them. And I'll be sharing a little bit about 2 advisory groups of young people living with and affected by HIV in South Africa. They're longstanding groups of adolescent advisors with the Accelerate Achievement for Africa's Adolescents Research Hub, which is based at the universities of Oxford and Cape Town. And the first advisory group in the Western Cape of South Africa was recruited over a decade ago by Professor Lucy Kluwer as part of her study of child carers of AIDS-affected parents. And the other started in the Eastern Cape of South Africa 4 years ago as part of the Mzansi Wako study of adolescents living with HIV and the Hey Baby study of young mothers. Each of these advisory groups had about 20 participants. They're mixed gender groups, and most participants were in their late teens and early 20s. And what I'm going to do today is I'm going to share what we learned from these young people about their COVID-19 experiences, challenges, and coping strategies. And through the process, I'll also share a little bit about the visual participatory methodologies that we used remotely. We conducted 27 art-based and participatory group activities online over Facebook, as well as 41 telephonic semi-structured interviews in 2020 and 2021. We then engaged a remote thematic analysis process with researchers across 3 countries. And we published the initial findings from young people's experiences during hard lockdown at the beginning of the pandemic. And then what we did is we worked with a South African artist to translate these 8 themes from this paper visually. You can see the first theme translated here, where young people talked about the sentiment of feeling really stuck in their lives and unable to continue with work and school, and also being stuck inside crowded homes. And why we engage this visual participatory process? Well, there's really a few reasons. So first, visual methodologies with youth can be really effective alternative ways to generate evidence and also to take action on pressing health and social issues. And visual methodologies have a rich history as well within the HIV epidemic. For example, body mapping has been used to challenge HIV-related stigma. And these methods can really show humanizing experiences and not just difficulties, but also strengths, which we know are there and are really important. And visual methods can also capitalize on youth strengths, creativity, and also their expertise in their lives and their own situations and contexts and environments. So here are 2 examples from common themes that emerged from narratives. So on the left, you could see young people spoke about financial shocks of hard lockdown, including lacking food and basic necessities. And you'll notice that each image is also accompanied with a quote. Our young colleagues asked that we do this so that their voices be included alongside images. And then we also learned, you can see on the right, about how young people demonstrated agency in these difficult situations, including borrowing food from neighbors and creating and leveraging social networks. And this is an example of communities, how they supported each other to meet basic needs in the absence of government provisions during early lockdown. We also asked adolescent advisors if COVID-19 was an animal, what animal it would be and why. And the reason we did this was to create a little bit of conceptual distance from a tough topic and to elicit additional meanings through symbolism. You can see here that COVID-19 was described as mostly dangerous, as an animal that would harm or kill people. And others described it as an annoying pest. And you can see here there's some mosquitoes, some irritating mosquitoes. And as is now coming out in much of the literature, mental health-related challenges were also very pronounced for many adolescent advisors. And something else that we learned is that adolescent advisors had really strong biomedical COVID-19 knowledge. So early into the pandemic, they knew about transmission and prevention and symptoms. And this really stood in contrast to the ideas that were common at the beginning of the pandemic, that young people needed more information and that they were reckless. And the thing that we also learned through these methods and really teased out was that although young people had really strong biomedical COVID-19 knowledge, it didn't mean that they necessarily trusted that it was true. We saw a lot of non-biomedical beliefs alongside vaccine hesitancy. And if you'd like to learn more, please check out our publication on young people's COVID-19 vaccine hesitancy in this context. So then after we developed these images with an artist, we sought feedback from young people over Facebook and from calls. And what we learned from them was first that they felt that this method and these illustrations visibilized and documented their experiences. Our young colleagues described feeling seen and that these illustrations supported them also to feel connected to one another during a very isolating time. We also learned that these illustrations elicited positive reflections on young people's coping and resilience. You can see here on the quote on the left, this young person said she saw the images and it was like she was almost sitting beside herself, watching herself through the pandemic and watching how she survived and managed to cope. And then the last thing that our young colleagues suggested is that they thought the illustrations should be engaged as an advocacy tool and shared with the government, and that it also helps them really see how they persevered during a difficult time. So in conclusion, this COVID-19 work with HIV-affected youth really affirmed the possibilities of visual participatory methodologies, and specifically to engage the creativity and agency of youth affected by HIV. These can also be fun and they're strengths-based as well, and they can be done even remotely and over social media. And through these methods, youth, alongside our research team, reflected on and commemorated their experiences during a really tough time. If you'd like to learn more, we have an art exhibition at the Global Village, which shows these illustrations alongside other art-based and participatory methodologies to reduce stigma and work with young people, including young people living with HIV in different global contexts. And thank you first to the Eastern and Western Cape adolescent advisors, and also to our partners and our funders at the Universities of Cape Town, Oxford, and Toronto.